Greetings, YouTube. It's been a hell of a week, and I didn't plan on making another video until after my next post-op, which will be on Tuesday. It's Saturday now, Saturday the 30th. My post-op is on the 2nd. But I wanted to snap a video real quick to talk about my leg. In the last update I talked about I was having some discomfort in my leg, and I thought it was muscular, and some of it could have been, but shortly after I shot the last video, maybe 6 or 7 hours later, I started having some excruciating pain in my calf, and it almost brought me to tears. That kind of pain, really bad pain. And at that point, I was going to bed, and at that point, I decided this is too much. I'm gonna contact the orthopedic practice and ask about this. So I knocked back some vitamin I, ibuprofen, and went to sleep. I called them the next morning, and I asked, what's going on? You know, is this something we should get checked out? They said, yeah, you should get an ultrasound in case there's a blood clot. And so I went to, they referred me to the radiology unit at a local hospital, and so I went and I got an ultrasound on my entire leg from like my crotch all the way down to my toes, and sure enough, there was a small superficial blood clot, luckily close to the surface. Apparently wasn't life-threatening yet, but if I just ignored it, it could have gotten a lot worse. And so the radiologist was kind of, they acted like it wasn't a very big deal. They just said, oh, well, we'll send this report to your doctor, and your doctor will tell you what to do. But I didn't need them to do that to know that I should get this treated. So I basically just turned around and went right to the ER and got treatment for it. They did some blood work to decide what would be the best blood thinner to put me on, and yeah, I was in the hospital all day on Wednesday, pretty much. It's Saturday now, so it's been a few days. But at first I thought, gosh, maybe they're going to cut into my leg and take it out, but I guess they decided that blood thinners would be the way to go. At first I thought maybe I would have to go get injections, because I know some of these work, the way some of them work is you get injections in your belly or something on a weekly basis or whatever. That would be a real drag, but of course you got to do what you got to do. Luckily, all my blood work came back normal, and so they said that I can take this new drug called Eliquis, taking 5 milligrams, and it's just a pill. I don't have to get injections of any kind unless that changes. Supposedly, like a month's supply of this drug is like $600, but they gave me a voucher to get it for free. $600 for a bottle of pills is highway robbery in my opinion, but what the hell do I know? I'm just glad that I got hopefully what I needed, and this will be all in the rear view mirror. They said take 2 of them twice a day for the first week, and then after that I have about a month's worth to go. I have to go and follow up with my PCP about that in addition to the post-ops and whatever, so it's kind of a drag to have to go to extra appointments, but you know, this is not something to ignore. So one update about the actual incision for my surgery: they had to undress my whole foot in order to just get the pulses under where the dressing was, and in the process they said that this is really healing up really impressively. It looks like it's going to be almost no scarring at all. Not that I really care about scarring on my feet, as long as it heals well. So I'm supposed to get the stitches taken out on Tuesday if it's healed up enough. That would be exciting. I'm hoping to be cleared to drive at some point in the next 3-4 weeks. We'll see what happens, but I'll make another video after my next post-op, but that was just an update. about my leg. And something I should throw out there is that ever since I've been taking the blood thinners, they said it would basically starve the blood clot, and the blood clot would start breaking up bit by little bit. And so while I still have had the pain in my calf, it has been decreasing pretty steadily. I wouldn't say rapidly, but steadily over the last 3 days. So that's really good. They still told me if I have any pain elsewhere, like if it possibly moved, if I start having pain in my, say, my thigh or whatever, like if it moved up or something, definitely just hightail it to the ER. Or if I have chest pains or shortness of breath, just go right to the ER. Don't even hesitate. Luckily, I've had the same pain in the same place the whole time, so I think the blood clot is just stuck where it is, and it's going to be slowly breaking apart. Let's hope. So that's my unscheduled update. I'll shoot another video on Tuesday after my post-op, maybe even get some footage of where the incision was. They say that it's going to be undressed after that, and I'll be able to shower without a shopping bag or whatever it is I've been using. So thank you so much for watching, and until next time.